deafness. All right, so I love this picture right here because it shows you the parts of the ear and the disorders that can cause, hearing loss in that area. But what we're going to focus on is two types of hearing loss. We have a conductive hearing loss, which this loss occurs in your outer and in your middle ear and impairs the sound being conducted from the outer to the inner ear. It is caused by conditions interfering with air conduction, and that's your build-up wax, foreign bodies, middle ear disease, all is listed on the screen. And then you have your sensorineural hearing loss, which is caused by the impairment of the inner ear and your cranial number 8, resulting in the inability to understand speech. Causes includes they was born with it as a baby, it's hereditary factors, any type of noise trauma, aging, Meniere's disease, and ototoxicity. So the difference between conductive and sensorineural hearing loss, we're going to dig in the next slides. So conductive hearing loss, this occurs in the outer and the middle ear, and it impairs the sound being conducted from the outer to the inner ear. So this patient will actually hear better in noisy environments. So with conductive hearing loss, the patient is going to speak softly, and it's because they are hearing his or her own voice, which is conducted by bone, and that seems very loud to that patient. So the first step is to identify and treat the cause if that is possible. If it is not possible, then this patient will benefit from having a hearing aid. All right, so we have our sensory neural hearing loss. So basically, this is damage to your cranial nerve 8. Do you remember what our 8th cranial nerve is? That is your vestibulocochlear nerve. So that nerve is responsible for understanding speech. So this patient is going to be able to hear the sound, but they will not be able to understand speech. All right, so this patient also may hear muffled and difficult to understand. So they're not really, they can hear, but it's going to be muffled, and it's going to be in it. They're going to have a difficult time understanding. So hearing aids makes things sound louder but not clearer. So would this patient really benefit from a hearing aid? It says in some patient it may benefit, but the hearing aid is going to make sounds louder, not clearer. And the patient with sensorineural hearing loss, they can hear the sound, they just can't understand the speech. All right, so some patient can experience sudden hearing loss, and that is what it is. Sudden hearing loss, meaning they could hear 10 minutes ago and now they can't hear. And it's unexplained what the rationale is behind it. And it usually just affects one ear, but this is a medical emergency. So clinical manifestations with our patients who have hearing loss, we want to be very sensitive to these patients because these patients have a problem communicating. So think about it. If you can't hear, how can you really effectively communicate unless, we do some other ways of communication? But a lot of times, patients who are experiencing hearing loss, they're embarrassed about it. So they may not ask you to speak up, right? They may just nod their head. They may be just strained to hear. So you definitely want to look for those cues. Or that patient may be bolder and they may say, can you tell me that again? Can you say that again? Can you say that again? So you notice that you're, repeating yourself. And also they may not respond to your question because they didn't hear you, or responding inappropriately. They may be embarrassed, so they may just go with whatever you say, whatever they think they heard you say. So you definitely want to make sure that you're communicating to your patient in a way that they can understand. All right, a patient will be irritable. So think about it. If you can't hear and understand, it's going to make you very irritable. So you don't want to take it personal, right? This patient may have low self-esteem. They may be withdrawn. This patient may suffer from depression because of this. So we would just want to keep all these things in the back of our head when we're taking care of patients who are having hearing loss. I know, have you guys ever with your grandparents, they just ask you to repeat things over and over. Huh? What'd you say? And if you speak louder to a patient with hearing loss, that is not fixing the problem. So you just want to make sure that you are communicating effectively. And also, just ask the patient, how do they best like to communicate? All right, so some patients may benefit from a hearing aid. We're not going to dig deep into all the different types of hearing aids because, as you can see, there's like 4 different types on the screen. But just knowing that the goal of a hearing aid is to improve hearing with constant use. So the biggest thing that I want you to make sure that you know is that when patients come into the hospital with hearing aids, I always like to bring them a denture cup. We literally use the denture cup for everything, but so that patient you won't misplace that patient's hearing aid. And I always label that cup hearing aid in there and put their sticker on there just so you don't lose it. But definitely making sure that patient keeps their hearing aid charged. And tell that patient just to bring their hearing aid with them all the time, because a lot of time patients don't use their hearing aid. Like, they're like, oh, I left my hearing aid at home. You want to make sure that you're keeping the hearing aid dry, because remember, it is a little machine, and if it gets wet, then it won't be as effective, or if it will even work at all. So you want to make sure that you explain the hearing aid to your patient. All right, so this slide is just talking about what I was talking about earlier about how to communicate with your patient. So hearing aids, yes. Assistant devices and technology techniques, yes. So lip reading. So that's when patients can actually read your lip, and a lot of people can read lips very well. So think about during COVID time when we had to wear masks. How were these patients able to communicate unless you had the papper that showed your face still? But think about that, how with your patients with hearing loss, that you may not need to wear a mask with them, that you may need to not speak over a computer screen so they can actually read your lips. And visual cues, like, what does this mean? We all know this means come here. We all know this means stop. So using visual cues and also sign language. But do know that sign language is not universal. So just how we have slang and stuff, like, or how we say y'all in South Carolina, if you go to Alaska, they may look at you crazy. So just remember that sign language is not universal. All right, so the last few slides are going to talk about the cochlear implant. So the cochlear implant is a device that helps people who cannot hear well and or they can't hear at all. So how does it work? So let's look at this picture on the screen, and we're going to go through each part. So the microphone, it has a small microphone that listens to the sound around you. And then it has a computer part. So the computer is, the device has a tiny computer that takes these sounds and sorts them out to make them clearer. And then you have a sender. Once the sounds are sorted out, they are sent through a transmitter to a part of the device inside your head. Then you have your receiver. The receiver is inside your head, meaning, so this is surgically implanted, right? There's a receiver that gets these signals and turns them into tiny electrical signals. So then the electrodes, these electrical signals go to the tiny wires that are put into your inner ear. These wires stimulate your nerves, which send the signals to your brain. And then your brain turns these signals into sound. Does that make sense? Not really, but just knowing that, the biggest thing that I want you to know is that this is surgically inserted. So there is a part that goes inside that they put in surgically, and then there's the part that goes outside. So it's a two-piece. Something is inside and something is outside. And basically it's bypassing those little cells in your ear that's not working, and they're going and doing all the work for you. So, and then it sends it to the brain to give you the sound. So just know that it's implanted, meaning inside, right? This is a surgical procedure. So which patients would benefit the most from a cochlear implant? And these would be your patients with sensorineural hearing loss, severe or profound hearing loss in one or both ears. Okay, so this is just a overview of some eye diseases and some ear diseases that I said I had to make a part 2 on, because these are some important things that y'all do need to know. If you have any more questions, bring them to class. If not, email before class or whatever you want to do. But definitely hope you guys got a deeper understanding of this material.